Everyone, and welcome to the Job Accommodation Network's Accommodation and Compliance Audio and Web Training Series. I'm Beth Loy, and I will be the moderator for today's program called Key Mental Health Solutions in the Workplace, featuring Melanie Wetzel, Jan's Cognitive and Psychiatric Team Leader. But before we start the program, I want to go over just a few housekeeping items. First, if any of you experience technical difficulties during the webcast, please call us at 800-526-7234 for voice and hit button 5. Or for TTY, call 877-781-9403. Second, we plan to answer as many of your questions as we can during the presentation, so please send in your questions at any time during the webcast to our email account, question@askjan.org, or you can simply use the question and answer pod located at the bottom of your screen. To use the pod, just type your question and then submit it to the question queue. Also on the bottom of your screen, you'll notice a file share pod. This is what you can use if you have difficulty viewing the slides or you would like to download them. You'll also find a resource handout that you can go ahead and download. And finally, I want to remind you that at the end of the webcast, an evaluation form will automatically pop up on your screen in another window if you don't have your pop-ups blocked. Now, we really appreciate your feedback, so please stay logged on to fill out the evaluation form. Okay, Melanie, now let's go ahead and start today's program. Take it away.
All right. Thank you, Beth. Well, the description for today's webcast was brief and to the point, but it included the most sought-after answers from employees and employers alike. We know that understanding the key issues in accommodating mental health impairments in the workplace can be challenging. So we wanted to offer this session at the start of this new year and at this new decade to help you learn more about successful and doable accommodations that will help in those challenging situations. I'm going to give a brief amount of information on each topic, and then we're going to let the examples speak for themselves. And as Beth stated, we're going to have 4 question and answer periods interspersed throughout the session, so you can get your questions in when the topics come up, or you can save them until the end.
Excellent.
Okay, before we get started, we just want to bring your attention to a big anniversary that's up and coming. The Americans with Disabilities Act, or the ADA, will celebrate its 30th anniversary this coming July. This legislation was purposed to improve the lives of people with disabilities by protecting their rights to have access to employment, public entities, transportation, public accommodations and commercial facilities, telecommunications, and more. It helps people with disabilities compete equally for employment and receive accommodations and protections they need to work. Stay tuned to the Job Accommodation Network in the coming months for more information and updates. Okay, these are the challenging situations that we're going to cover this afternoon in this webcast. We're going to talk about leave, telework, stress reduction, returning to work, modified schedules, supervisory changes, service and support animals, performance and conduct, completing essential functions, and confidentiality and morale issues. And some of these are going to kind of overlap. You'll see in some instances leave and returning to work kind of overlap, but there are enough differences too, because we just want to make sure you got really good information. Okay, so leave is an accommodation that can be very effective for employees with mental health impairments. Leave can be provided in varying amounts of time and in various circumstances. Leave can be intermittent for counseling, rest, and treatment. It can be provided for hospitalization, for evaluations and treatment, but it can be an ineffective accommodation, though, if an employee is able to work. So we're going to look at our examples here. Addie is a teacher with PTSD who's having an exacerbation of symptoms with the approaching anniversary of the trauma she experienced. She asks for leave for 16 afternoons, 1 each week, in order to receive the treatment her doctor feels will prevent more advanced symptoms. Her employer finds no hardship in providing a substitute for 1 afternoon a week for 16 weeks. Jude goes to his supervisor to explain that he's having thoughts of suicide and harming himself. The HR director is brought into the situation. After a thorough discussion with Jude, they decide to call his brother to come and get him. They get a call the next day from his brother stating that Jude was admitted to a facility for treatment and requested time off for him. The employer granted the leave for Jude, requesting more information from his brother when he knows more about the time frame involved. Jake became increasingly paranoid and thought his coworkers were out to get him. He gradually became unable to do his assigned work. For several days after a brief period of leave, Jake showed up late, highly confused, and very unkempt. Jake's employer had a private discussion with him about his current state and his inability to do his job. They placed Jake on leave so that he could get the medical evaluation and treatment it appeared he needed. And our last example here in this section is Sue. Sue is an employee with mental health impairments who began taking new meds and needed the accommodation of temporarily working to shorten schedule. She asked to work 10-hour shifts instead of 12-hour ones for 4 to 6 weeks until she became more acclimated to the medication. Sue's employer immediately put her on leave while they worked out the situation for both parties. This example of leave seems to be ineffective not only for Sue, as she is still able to work 10 hours per day, but also for her employer, who now has a position where no work is being completed. Okay, our next topic here is telework. Telework is another effective accommodation if the employee's job can be done from home. Not every job can be completed 100% of the time from home, nor do all employees with disabilities need to work from home daily. As always, each accommodation request should be considered on a case-by-case basis. The issues we're going to address this afternoon through our examples include intermittent telework, providing telework for trial periods to test its effectiveness, and telework as a last resort. Our first example involves David. David asks for an accommodation of intermittent telework to help him manage his anxiety symptoms that have been exacerbated in recent months. His employer agrees to 2 days a week, Tuesdays and Thursdays. David states that he cannot stick to a regular schedule of working from home as he may not have symptoms every Tuesday and Thursday, but feels that 2 days a week should be more than enough days and agrees to let the employer know when he'll be staying home as soon as he's able to do so. They both agree to try it for a couple of months to see how it works. Jasmine asks for telework 5 days a week to help her deal with her bipolar disorder, sleep schedule, and stressful commute to work. Her employer obtained medical documentation that supported Jasmine's need to be at home 100%, but was hesitant to allow the full week, as part of her job required her to rotate in and out of a customer service window with her coworkers. A trial period was agreed upon that would allow Jasmine to work from home 3 days a week and have a heavier presence at the window on the days she was in the office to balance out the responsibility. Zeke has not worked in his current job for the amount of time required to telework, but after a very stressful episode in the office, he asks if he could work from home temporarily until he can regulate his symptoms. Zeke's supervisor was willing to allow him to work from home initially for 2 weeks to evaluate the effectiveness, then determine at that point if it could continue to be an effective accommodation. And our last example here is Denise, who is hypervigilant and aware of her surroundings at all times. While this may have been helpful during her military service, it can make completing her work difficult in a busy office space. Denise's performance has slipped in the last several months, and her boss reached out to see what was going on. Denise disclosed that she has TBI, a traumatic brain injury, and PTSD, and her struggle with concentration due to the noisy work environment. She requested a private office, but none was available. Her employer offered to provide a noise cancellation headset during her shift, but that was ineffective. Denise was distracted by noise and the constant visual stimulation of her coworkers. Her employer determined that Denise could do all of her essential functions from home and offered telework where she could control her own environment. Okay, next we have reassignment. And reassignment is generally an accommodation of last resort that can be done at any time if the employee and the employer agree that it's the most effective accommodation. The points we want to make today through our examples are that the employee does not have to create a position, nor do they have to bump someone else out of their position, and that the employee has to be qualified for the position, but not necessarily be the most qualified. Listen up here for our examples on reassignment. Han asked to be moved from the night position he was hired to a day shift because of medications he takes at night. Han's employer tells him that there are no open day shift positions at this time and that they will not be creating one for him. They ask Han for alternate accommodations in order to help him do the night shift job. Jason asked for a reassignment after multiple attempts to accommodate him in his current position were unsuccessful. The HR director told him to look for jobs he was qualified for, apply for them, and they would interview him like everyone else. Jason needs to be qualified for the position, but he doesn't have to be the most qualified, and asking him to compete for the job takes the accommodation out of it. The HR department should be working with him to find the open positions he's qualified for and then placing him into the one that is the best fit. Thomas was having difficulty working in a busy central office. He managed a large staff of workers, provided customer service, and had daily oversight of the office. After meeting consistently with his supervisor, it was determined that Thomas would be the ideal manager to fill a recent opening in a smaller and less busy branch office. He maintained his salary and the responsibilities of his leadership role. Okay.
All right, Melanie, we do have some questions. Are you ready?
Okay.
Okay. Well, on slide 5, you talked about reassignment, but then you addressed it in some detail on slide 6. But how about we just clarify a little bit about reassignment? The attendee said, wouldn't reassignment be the last resort? You want to clarify that reassignment typically is one of the things they look at last, unless everybody agrees.
Right. And under reassignment, it would be best to look at all the possible accommodations that would be able to keep the employee in their current position successfully. And sometimes that's just not possible. And so when an employer has tried all the accommodations that they know of or they can think of, and they've called us sometimes, and we've talked about the ones that we know of and the things that we think might help, and none of those have really helped, then that could be the time to reassign someone to a new position. But there are times when an employee asks for that and the employer agrees that really may be the best situation.
Okay. And then follow up to that, how long should an agency do a job search for a reassignment?
Well, I think that's a good question. I think that depends, too, on the size of the agency. If it's a small agency and they know exactly they're not going to have any jobs, they have no jobs now, they're not going to have any jobs come open that they know of, that may be a shorter search than a company who has a lot of jobs that are open or may be coming open, and that person may be able to search a little bit longer and find a really good job match.
One of the things I usually ask an employer is, how long does it take you to hire somebody? It takes us forever.
Right. Yeah, that's a good thing to look at because you have to post it and then interview and hire somebody, and then they have to kind of get up to speed on the job too. So
another follow-up to reassignment, is an employer able to change the pay when reassigning?
Yes, an employer can change the pay due to reassignment. They never have to promote somebody in a reassignment. They could do that. That's not required under the ADA. But they could put somebody in a lower position. And a lot of times that can be a really effective accommodation because sometimes the person can no longer do the job tasks that are in their current job like level or classification. And sometimes all they have is a lower position. And yes, they can change their pay. That would be based on that new assignment, unless they have a policy where they pay people without disabilities when they move them around to different jobs or a lower position. And when we talk to employees, we'll tell them, that may not be preferable, may not be what you want, but if you're unable to do the job you're in at this point, then moving to another job, even with less pay, would still give you a job for now with a paycheck and would still offer benefits if it's a benefit-eligible position, and then maybe in the future they could move into a job where they could make more money.
And we always look at equivalent positions first.
Right,
of course.
absolutely.
And then we can go to something lower. So if an employee states that he or she wants a reassignment because that person cannot work for a specific supervisor and management's fine with the reassignment, do you look at other accommodations, or do you just go ahead with the reassignment?
Well, we have a section coming up when we're going to talk about supervisory issues. And sometimes I think it might just make good business sense to go ahead and reassign a person if they can't work for a specific supervisor. You can always look at, well, instead of changing the supervisor, let's look at changing supervisory method. But if the management is fine with the reassignment, that may really be the best thing to do, and just do that first thing quickly.
Right. Let's see. If prior to requesting telework as an accommodation, the employee was on telework but not underperforming, do you still try telework as an accommodation? I wonder if that means if the employee was teleworking with...
But was underperforming.
Right.
Well, I think one of the things you would look at, even if someone's teleworking and they're underperforming, you would still need to look at, are there other accommodations that they need? Just like if they're in the office and they're underperforming, you can have that same conversation with them. Just because you telework doesn't mean things are different. They can still meet those production or performance standards, and you can have that conversation as, here's where you need to be, you're not quite there, how do we help you get there? And look at if something else could be put in place to help them so they can meet those standards but still remain at home.
Okay. Take one more here, Melanie. Then we'll move on, come back to some of the other questions.
Okay.
Can an employee take a medical leave for changing mental health medications?
Yes.
This is quite common.
It is. We get a lot of requests, or we talk to a lot of people. We don't get the request, but we talk to a lot of people who have that request, because a lot of times people are just unable to work during that time, and they can work shortened hours sometimes, and that may be effective, and some people just really cannot. They just need to be off, and that would be then up to the employer to determine if that's reasonable or not.
And sometimes the medication might be the wrong medication, and the employee has to start over again.
Right. Yes, sometimes they end up taking 3 or 4 different types, and then, each time they have to give that enough time to see if it's effective or not.
Yeah. Okay, let's go ahead and move on.
Okay. Now we're going to talk about stress reduction. We get tons of questions here at Jan about removing functions from the job that cause stress, as well as reassignments to stress-free jobs. Well, we all know that's not really a thing. All jobs have some element of stress, and it varies from employee to employee as to what triggers it. Our best advice when dealing with employees that have undue stress on the job is to look specifically at what's causing the stress. Identifying it goes a long way to minimizing or eliminating the stress from the job through accommodations. And again, that's on a case-by-case basis, because what might cause stress for one person really might not cause it for somebody else. So our examples involving stress on the job start with Ty. Ty works in a call center as a customer service representative. He asked for the accommodation of answering chats and emails only, as talking on the phone to customers caused him stress. His medical documentation supported his request. Ty's employer asked for more specific information about what was causing him stress. They needed to determine what they could do to minimize, or better yet, eliminate the stress in taking calls so that he can perform his essential functions, not remove them. Does Ty need more training to be comfortable talking to people? Does he need conflict resolution skills? Or does he need to have a quicker access to his resources in order to answer customer service questions easier and more thoroughly? Jimbo, an employee with autism and anxiety, is not performing well. His doctor recommended visuals when being trained and the ability to take time away from stressful situations in order to de-stress. Jimbo is not using the visuals provided, but rather running to ask questions time after time. His need to de-stress has ended up involving more time than he actually spends working. So Jan recommended organizing his visuals into a color-coded binder that makes sense to him, and a flow chart with steps for problem solving where he knows what exact steps to take before asking someone else a question. The employer does not have to provide unlimited paid breaks, as it interferes with Jimbo's training and the completion of his job duties. So they talked to Jimbo about the things that are causing his stress and asked his doctors for ways to accommodate him to help him be calmer in the training and reduce the everyday stressors. For example, does he need a different environment or a different workspace, a smaller or quieter location? Our next example is a large metropolitan police department that employed a records specialist who was finding it difficult to complete the essential functions of his position. The increase in violent crime over the last several years had taken a toll on the employee, causing increased anxiety, stress, and emotional breakdowns. Attendance was also becoming an issue. When the employee discussed his options for reasonable accommodation with a supervisor, he was pleased to discover several open positions he was qualified for that would take him out of the particular area that was causing his mental health condition to deteriorate. Okay, now we have returning to work. Returning to work after leave for mental health impairment can be a challenging situation, but it may not be as difficult as some employers seem to make it. We would advise employers to rely on the medical documentation the employee submitted when making decisions about when an employee is ready to return to work. Many employers work cooperatively with employees in putting a plan in place while they're still out on leave so that the return to work is very smooth. Other employers refuse to engage in the interactive process while an employee is on leave. See how the following examples show the effectiveness of both strategies. Truett had been on leave for several weeks after a suicide attempt. The medical documentation he submitted stated that he'd been following the treatment prescribed by his psychiatrist and was doing well enough to return to work, with flexibility in his schedule to continue counseling 2 times per week. Truett's employer refused to allow him to return to work until he could work his full schedule without the need for counseling. So my question is, who here is better qualified to determine if Truett is ready to return? The psychiatrist who's been treating him or his employer? And Truett doesn't need to be at 100% before returning to work. That's what the accommodations under the ADA are for. Our next example is Hal, who had been hospitalized for a mental breakdown that had occurred at work. He provided information from his treating psychologist and his therapist as to his readiness to return to work. His employer wasn't sure if it were safe for Hal to come back to work so soon. The employer called Jan to discuss the situation and was encouraged to trust the medical documentation that stated working was good for Hal's recovery as he continued his treatment. If an employer has specific questions or concerns about an employee's return to work after hospitalization for mental health issues, it is possible to reach back out to the doctor or the therapist for more information. That way, the decision is based on current medical documentation and not the employer's fears or uncertainty. In this next example, Alex has been off work for several months in order to obtain treatment for his depression. His doctor recommended he return with the accommodation of a flexible start time, increased breaks when needed, and a weekly meeting with his supervisor in order to help him stay on task. Alex had gotten the information to his employer weeks before his return so that he could go back to work with an accommodation plan in place. Alex's employer requested a little more information about the request for the flexible schedule and breaks and what that would look like on a day-to-day basis. Once they had a better understanding of Alex's needs, they agreed to the accommodations and were ready for his return to work with an eagerness that matched his. And our last example here is Casey, and Casey's employer will not engage in the interactive process with employees on leave. She feels that she will be unable to return to work without accommodations. The lack of progress heightens her anxiety, so Casey asks for extended leave. Could the need for extended leave in this example have been eliminated with an employer policy that allows the accommodation process to take place while an employee is on leave in order to return her to work earlier with accommodations in place? Okay. Here we're talking about modified or reduced schedule. An accommodation of a modified or reduced schedule can be effective for employees with mental health impairments who need time off so they can attend appointments or to rest and recuperate. The issues we're looking at today involve part-time work that transitions back to full-time, employees needing a more set or regular schedule, and the denial of these accommodations as a hardship. Remember that a hardship, simply explained, is an accommodation that's too costly, too disruptive, or would change the nature of the business. So let's start with Sally. Sally is returning to work after a somewhat lengthy hospital stay for inpatient mental health treatment. Sally is accommodated with a part-time schedule of working 4 to 6 hours Mondays, Wednesdays, and Fridays, with Tuesdays and Thursdays off for therapy and recuperation. She plans to increase her schedule, transitioning back to full-time as she's able. Our next example is Holly, and Holly's sleep schedule has become unstable due to working variable shifts in retail. She works many late nights, followed by early mornings. Holly asks for a more set schedule with adequate time in between shifts for sleep. Her employer at first is hesitant, as he keeps repeating, "This is retail, you have to be flexible." But once he realizes what Holly's asking for and why, he agrees to schedule her in a more set way day to day, with no late nights followed by early mornings, and without cutting her hours. Our next example, John. John was hired as a chemist in a lab setting where everyone was expected to work 10-hour days, 5 days a week. On John's first day, he submits a note from his doctor that he can only work 8 hours starting that day due to a mental health impairment. The employer denies the request as working the number of hours is an essential function of the job. Everyone knows it when hired, and everyone is expected to do so. He asks John what other accommodations can be put into place to allow him to work the scheduled 10 hours. And here, our last example in this section. Actually, we have 2 more. Okay. Jody works on a manufacturing line that involved many people, all working together to get the work done. Due to her anxiety, she needed frequent breaks away from the job tasks. Jody asked for the accommodation of being able to walk away from the job when needed, often for 10 to 15 minutes at a time, without advance notice. Jody's employer was not able to accommodate her in this way. It was a hardship for the production to stop the line and shut everyone down without notice. The employer asked for ideas to help reduce her anxiety so that she could continue working. They also suggested reassignment as a possible solution if her inability to work her shifts with limited breaks continued. Okay, so here's our last example. After being on leave for several months, Ike asks to return to work on a part-time basis, working 30 hours in order to keep his benefits, to help him get back on his feet and prevent the stress episodes that put him on leave to begin with. His employer denies the accommodation as a hardship, explaining to Ike that if he cannot return full-time to full duty, he cannot return at all, as part-time work creates a hardship. He told Ike to let them know when that was possible and he could return. And so, of course, my question there, and we get this question a lot, is what is the hardship? You know, you'd think that being out of work for 40 hours a week would be more of a hardship, as others would be having to get Ike's work done, or else it wasn't getting done at all. Would it make more sense for Ike to be able to get 75% of his work done than none at all? Not to mention that requiring an employee to return to work at 100% could possibly end up being a violation of his rights under the ADA. Okay, and now we have time for questions.
Thank goodness. There's smoke rolling out of the questions.
Oh, okay, good.
All right. Okay. Let's see. We have told employees the ADA doesn't require employers to provide accommodations where an employee comes and goes as they please. Is that correct?
Yes, that is correct. Absolutely. Yeah, you can still hold employees with disabilities to time requirements the same as you would require others to. But you do want to look at how do we accommodate that employee. And for an employee who works on their own, has their own work, and it doesn't affect anybody else, that would be an easier situation to accommodate with flexibility than like this person on a production line that shuts the whole thing down and nobody gets any work done.
Okay. We have 24/7 operations. An employee asks for light duty, access to day schedule only. Schedules are set 6 months in advance. Employees can informally switch schedules with other employees, but the need for light duty is cyclical, and it is related to forecasts during severe weather. So,
okay. Well, let's talk about the light duty. You know, a lot of times we hear from employers that they have actual light duty positions. There's certain positions for people who've been injured, who come back to work needing accommodation. But also light duty could mean just in your current position with accommodations. And so you want to be careful to look at that. What is if the person asks for light duty, what are they really asking for? What are the accommodations they really need? Because that could be accommodated in their current position, possibly. If they need access to day schedule only, that depends. If your schedules are set in advance, or your schedules are the day shifts given as to people who have seniority. You know, if that's the case, then you don't have to put somebody who doesn't have that seniority on a day shift position. If that's what you do, everybody expects that, that's a known thing. You know, if you have made exceptions before, then it might be possible to make that exception for this person. If employees can informally switch schedules with other employees, how's that done? Is there a board where they post that? Is the employer helping that? So if it were an accommodation, I think the employer could look at how do we help this employee see about changing schedules with somebody. However, that make sure that person understands that process, or the employer help in some way in that process.
I agree with you. The employer needs to document that the employer has looked for ways to streamline this process rather than be an impediment in the process. If they really are set 6 months in advance and it's an undue hardship to change those schedules, the employer needs to document why it's an undue hardship.
Right.
Okay. How much should we factor in the stress of a commute, as you mentioned it, impacting bipolar disorder?
Well, I think there's several things to look at there. Is it going to be a long-term thing, a permanent thing? Is it just a short time frame? Is it during bad weather?
What's the trigger?
Yeah, what's the trigger? I remember a call once where the guy, if it snowed, he could not leave his house. He lived in New York, so that could be snow a lot during the winter. You know, is that going to be a hardship during the winter? Is it possible for him to do his job on those days, or does he need to just take leave?
Looks like the trigger is a lot of traffic.
A lot of traffic. Could the hours be flexed a little bit so that the person's not on the road during those peak travel times? That would be one thing. Can the person do the job from home? Can they work part-time from home and then come in the office part-time in the afternoons, or however that would work where there's least traffic time, and not work a whole day from the office?
Okay. If driving is not a requirement to perform their essential duties, then must the agency authorize telework? And of course, this is due to the employee's inability to drive due to medications taken for a psychiatric condition.
Well, I would say that would be something to look at, yes, and consider on a case-by-case basis. Can that person telework? Can they do their job from home? Another question is, if they can't drive because of the medication, that's one thing, but can they actually work because of the medication? Because sometimes we hear that people can't really function. It's not that they can't drive, it's that they can't really function, even for a short amount of time. So leave may be a better accommodation in that regard. And you can always do telework. Here's a really good thing. You can always do telework on a temporary or trial basis to see if it works. You know, some employers say they can tell in a couple of days if it's going to work or not. You know, with certain employees, they're responsible. They get the work done. Studies show that people can be up to 27% more effective when they work from home, so it could be a really good thing.
One toss, toss one leave question in here, and then we'll move on. Should an employer count FMLA leave provided as part of leave given as a reasonable accommodation?
Yes, they can do that. They can count that. A lot of employers count that first. The FMLA comes first. And then if the employee runs out of FMLA leave and still needs more leave, then they look at that as leave under the ADA after that, and then look at how much leave they can provide after the FMLA without it causing a hardship.
Okay. All right, Melanie. Let's keep moving along here.
Okay. All right. So here we have supervisory changes. The psych team at Jan gets many questions about changing a supervisor as an accommodation. This can be due to personality differences where the employee feels he could work more effectively under another supervisor. Difficulty getting along with a supervisor and or coworkers in the current assignment may precipitate a request for a new supervisor. Issues frequently develop when a new supervisor comes on the scene and makes changes without regards to accommodations that may have already been in place and were working effectively. Our conversations during consultations tend to focus on changing the supervisory method instead of the supervisor. As you probably know, changing the supervisor is not required under the ADA. Employer can go above and beyond the ADA, of course, but it's not required. So let's get to our examples here. We have 3 good examples. Paula has worked successfully from home full-time for over 10 years. When a new manager is put into place, she calls all employees back to the office, no exceptions. Paula is devastated as the telework has helped her keep a regular schedule for her meds and her sleep needs. As a result, her bipolar disorder is well under control and she's in the best health of her life. And her work evaluations have shown how successful the accommodation has been. The consultant at Jan helped her to formulate a letter asking for the continued effective accommodation of telework due to a disability under the ADA. She was able to show the new manager how effective telework has been for her and how continuing it made sense for both parties. Once the manager understood Paula's needs, she apologized for her hastiness in recalling all workers, causing Paula the added stress she didn't need, and agreed to continue telework as an accommodation. Ashley's an employee who's had a reduced workload as an informal accommodation. She's upset and feels she's now in a hostile work environment when a new supervisor tells her that she will have to start doing all aspects of her job. She asks for a new supervisor. The employer explains that although she may have been accommodated with a reduced workload in the past, she will now be expected to do the full scope of her job, but with accommodations that allow her to complete the work. The employer asks her about the accommodation she may need, as well as the type of supervisory method that might be most effective for her. In our last example here, Nigel has trouble focusing and retaining information, especially information and instructions his supervisor seems to tell him on the fly. Nigel asked for an accommodation of information and directions in writing and weekly sit-downs with his supervisor to help keep him on track. And let me just say this, we get a lot of questions about difficulty with a supervisor. I don't want the supervisor in my face. Can I have more communication in writing? Absolutely. If that works in that employment situation, sure. A lot of people with mental health impairments have issues with memory and they have anxiety. And if they could have things written in emails or directives, whatever, then they can go back to those and look at those, and it helps with memory. It helps with that having fewer interactions with their supervisor, and that might reduce the anxiety as well. Okay, as you might suspect, service and support animal questions run rampant here at Jan at times. With no real guidance under the ADA, we advise callers to look at the request for a service or support animal as an accommodation the same way they would look at any other accommodation. With training as an issue when bringing an animal in the workplace, we address the effectiveness of a demonstration of the training and behavior of the animal as opposed to a certification of training. We also recommend trial periods as a way to determine if the animal is appropriately trained for the work environment and to see if the accommodation is effective. Let's get right to our examples. Tia brings her support animal to work without asking for an accommodation, as she feels is her right. When her employer asks Tia about the dog and requests medical documentation, Tia is so upset that her employer violated her rights that she quit her job on the spot and calls Jan to file a complaint. The use of a service animal or support animal in the workplace is an accommodation, the same as a reduced schedule, working from home, or specialized computer software may be. Employees should understand that the employer has responsibilities under the ADA, but also has rights to determine if the accommodation is needed because of a medical condition and why. Our next example, Lena asks to bring her newly acquired service animal to work to help her with the anxiety that has consistently been increasing over the last several years. She provides documentation from her psychiatrist that verifies her disability with the information from Lena that reports the effectiveness of the dog, how it has helped keep her calmer at home, and the surety that her work performance would improve with the dog's presence in the workplace. Her employer agrees on the condition that she submit certification of the dog's training. Lena has trained the dog herself, so she has no certification. Her employer calls Jan for help. Under the ADA, there's really no sure guidance about service and support animals in the workplace. So the consultant at Jan and Lena's employer discussed the dog's training, the lack of certification, and the idea that a demonstration in the workplace may be a more effective way to evaluate the dog's training and subsequent behavior than a certification that could be authentic but also may be bogus. Lena's employer agrees to a trial period as she demonstrates the dog's behavior in the workplace over time to determine if the dog has been properly trained for the environment. And there are different work environments, and sometimes dogs trained at home are fine at home and they get in the work environment, and there may be a lot going on. There may be all kinds of different people and things. And so the dog needs to be trained specifically for each environment, and that's what's important. So we have one more example here. Zane asked for a reassignment from a stressful call center to an area where he would still answer calls, but not of such a demanding nature. He also asked if he could bring in his support animal for the new area. Zane's employer was able to find him an immediate job in another type of call center and started an interactive dialogue about the support animal, which turned out to be a guinea pig. Zane was able to give specifics about the animal, what it would do for him on the job, and how it would be housed and taken care of. His employer found no reason to deny his request and allowed Zane to bring his support animal on a trial basis so they could determine its effectiveness. Okay, performance and conduct. So under the ADA, an employer is not required to lower performance or conduct standard that's applied uniformly to employees with and without disabilities. However, the employer does need to consider providing accommodations that will enable the employee with a disability to meet those standards. Ideally, employees will request reasonable accommodations before performance or conduct problems arise, or at least before they become too serious. Although the ADA does not require employees to ask for an accommodation at a specific time, the timing of a request is important because an employer does not have to rescind an evaluation or discipline, and that includes a termination that's warranted by poor performance or by misconduct. Employers can have zero tolerance policies for all employees. Good documentation as employers go through this process is vital. Our first example is Frankie. Frankie worked as an administrative assistant in a large office. Her desk was centrally located, so she was available to all. As Frankie showed an increasing inability to deal with the demands of her job, she began leaving tasks undone, isolating herself, and wearing a headset so no one would talk to her. Frankie stopped answering her phone and eventually constructed a partition around her desk from cardboard boxes. Frankie's supervisor discussed her performance and conduct, stating that in her position she had to be available to those she assisted. He asked her how they could help her work more effectively, suggesting that they might be able to move her desk off to the side, add a partial partition to allow her some privacy, and provide her with ways to reduce the noise and distractions. He considered a policy change where she would get more of her assignments in email so that there would be a reduction in the constant traffic around her desk. A human resource manager was faced with terminating Todd, an employee who during a lunchtime game gone wrong grabbed one of his coworkers by the neck and began to choke him. The employee stated that he was under immense stress because of a home situation and the illness and impending death of his grandfather. The employer stated that they had a zero-tolerance policy for placing hands on coworkers and continued with the termination. Our next example here is an employer who had been accommodating an employee with little success over the course of 18 months, asked a consultant at Jan how to make sure they were compliant with the ADA, but at the same time evaluating whether the employee was qualified for the position. Topics discussed were completing essential functions, accommodations that had been provided, time frames for the accommodations, and how much the performance had increased over that amount of time with the accommodations in place. Jan stressed the importance of detailed documentation that would include the number and variety of accommodations provided, the increase or lack of performance as a result of the accommodations, how long the employer allowed for other employees to get up to speed, and how the lack of progress affected the business.
All right, questions. Are you ready?
I'm ready.
Okay. What animals are covered under the ADA?
Really dogs. Really dogs. Maybe miniature horses.
I think the better question here is under Title I, what animals are excluded? There really aren't any excluded or included under the employment provisions.
Right. And that's where I think the employer really needs to look at what's reasonable. And with the example of the guinea pig, that's not your normal support animal. But I really like the employer's answer because when I talked to him two times he said, I really can't see a reason to say no. And his willingness to say, let's try it and see how it works.
And that's, of course, under the employment provisions. If you're talking about Titles 2 or 3, they do specify what animals are covered. And that would be the service dogs or miniature horses under those titles. But under Title I, it's wide open.
Right. And you know, we do get calls for a variety of different animals, and I think that the employer just has to look at each case on an individual basis. What's the work environment look like? You know, in an example where it's a call center for a big animal supply place, they're allowed to bring their pets to work. Well, if everybody brings their cats and dogs to work, then a person who had a bird as an accommodation, how is that going to work in the workplace? Is that going to be possible? You know, what needs to be put into place? And that would be different in that situation than somebody who works in their own office. And so I think it just goes back to looking at what's reasonable in the situation and, again, on a case-by-case basis.
I have multiple questions about allergies and service animals in the workplace. We do have some guidance written up on that, don't we?
Mm-hmm. We do. And while we're talking about that, I don't know if you saw, we do have a resource page available, and it covers topics that we've talked about today, some very specifically. It's a good place to get more information on those topics and probably some more examples. I think, you know, I had a call just last week, and they had an employee who wanted to bring the service animal. They had cleared that. As soon as that happened, they had an employee come forward that said they're allergic to dogs, and they didn't know what to do. Well, you can get that same information from someone with an allergy. Let's see your medical documentation. Let's see what we can do, and then talk about that and weigh out both of those. If both people have a medical condition or disability and they both need accommodations, then you would just need to look at, you know, what's reasonable for both of those, balancing that out.
And we have laid that out, I think, in a pretty helpful manner. So take a look at that resource list. Okay, Melanie, let's dive into this. Is this our last section?
It's our last section, and we're talking about removing essential functions or completing essential functions. Remember that under the ADA, an employer does not have to remove essential functions from a position. They can go above and beyond the ADA, but a better way to handle the situation is probably to accommodate the employee to enable them to be able to complete the essential functions. We often talk about job restructuring as an accommodation, but that generally involves removing marginal as opposed to essential functions. And we do talk to employers that do remove essential functions, and that's usually done on a very temporary basis, sometimes when somebody's coming back to work or trying to get back on their feet. But again, it's up to the employer, and they can go above and beyond the ADA. But let's get right to our first example here. Toby was having difficulty with major errors in her work. She felt that her difficulties with focus and concentration interfered with her ability to be detail-oriented. Toby asked for the more difficult parts of her job to be assigned to a coworker who was able to do a better job. Toby's manager sat down with her to determine what difficulties were causing her errors. Instead of removing essential functions that were difficult for her, Toby's employer provided accommodations to help her accurately do those tasks. They started with retraining, providing her with a mentor, and looking at distractions in her work area. In our next example here, Rob's employer denied his request for an accommodation of extended deadlines and a reduction in his caseload by 50%. Rob felt that his employer was discriminating against him because of his disability and his difficulty with clear thinking and focus, especially in the afternoon. Rob's employer explained to him that they would not be able to reduce his caseload, as all employees had to carry a full caseload, and that it would also create more work for Rob's coworkers. He also explained that the deadlines were not established by the office, but were state guidelines and could not be modified. He asked Rob to consider how they could help him meet the deadlines and be better able to complete his work with better clarity and focus. Accommodations initially provided included allowing Rob to work earlier hours when he had better mental stamina and when the office was quiet with fewer coworkers in attendance. A very organized coworker who was adept at completing tasks on time worked to mentor Rob to help share his successful strategies. A checklist was provided that would help Rob keep track of what he had done and what yet needed to be completed. Okay, confidentiality. There are very strict guidelines as to confidentiality of medical and disability information under the ADA. Employers need to be very careful not to give out information to coworkers about accommodations that an employee may be receiving. By doing so, the employer is in effect telling the coworkers that the employee has a disability. We often hear from employees that their accommodation requests were denied because the employer felt that the accommodation would be unfair or detrimental to coworkers and morale on the job. Not a good reason to deny an accommodation, by the way. The employer may just need to learn how to be savvy when approached by coworkers with questions. Let's start here with a couple of good examples. Renee needed to have a compressed schedule for a set amount of time while she attended an outpatient treatment center. When her request was approved, Renee reminded her employer of the confidentiality provisions of the ADA. The second week into her schedule, two of Renee's coworkers asked their supervisor why she was able to work 4 days a week and have Fridays off. Her supervisor stated that they respected employee privacy and had no need to discuss personal information about a coworker. The employer may be able to make this point effectively, too, by reassuring the employees asking the questions that their privacy would similarly be respected if they found it necessary to ask for some time of workplace change for personal reasons. And our next example here is Mina. Mina is a computer programmer who was denied the accommodation to telework temporarily, even though she could completely do her job remotely. Her employer claims that if they allow her the privilege, they would have to allow it to all employees. What's fair for one is fair for all. The duty to provide reasonable accommodation is a fundamental requirement because of the nature of discrimination faced by individuals with disabilities. Although many employees with disabilities can perform jobs without any reasonable accommodation, there are workplace barriers that keep others from performing jobs they could do with some form of accommodation. Reasonable accommodations remove workplace barriers for individuals with disabilities. An employer cannot claim undue hardship based on the fact that the provision of a reasonable accommodation might have a negative impact on the morale of other employees. There's also what's called a modified workplace policy under the ADA that states an employer can modify a policy for a person with a disability that they do not change for others. This type of policy could be modified to include telework, schedules, bringing in an animal, and more. Okay, that's all I have.
Wow. All right. Okay, we got questions. Definitely fill this few minutes here. First question, Melanie, if a disability is predicted to last about 8 weeks, would it qualify under the ADA?
It could, yes. That time frame that used to be considered like 6 months or more has really been taken out of that. And what you really need to look at is how substantially limiting it is, because it could be really substantially limiting even if it only is 8 weeks.
Yes, it can. If it substantially limits one of those major life activities.
Right.
Two questions about supervisors and confidentiality. First one, how do you recommend discussing accommodation options with supervisors without disclosing too much about an employee's condition? And second question, can we tell the direct supervisor employee has requested an accommodation?
Yeah, you can talk about accommodations, you can talk about the limitations, but you want to be really careful not to give that medical information, a diagnosis or anything like that, to the supervisor or manager. They probably need to be involved in the accommodation process. Let's say somebody requested a flexible schedule and they're going to be coming at 8:30 now instead of 8. The manager needs to know that so it doesn't think they're late every day. Doesn't need to know why. Doesn't need to know if they have PTSD or ADHD or sleep disorder or whatever. They might need to know that they are having difficulty with organization or something like that, but they don't need to know the medical condition, the particular medical condition.
And I think this depends on the workplace, too. You know, there are some places, like maybe it's a fast food chain, and the fast food chain may have 1,000 different direct supervisors. You know, we just don't know how every workplace is set up.
Right.
For some, it might be important, but for others, probably not. But yes, what Melanie said, you can talk about the change, for sure.
Mm-hmm.
Like, say you have to get IT to put a piece of software on a computer. You wouldn't talk to IT about the reason why. You would tell IT this needs to be put on the computer.
Mm-hmm.
And here's what you need to do with that piece of software. Okay, so next question, what makes an accommodation ineffective?
Oh gosh, wow. That would mean that it doesn't work. That it doesn't work for the employee. It doesn't work for the employer. Sometimes we hear from employees that they think things are working great and it's really not working for the employer. So that would make it ineffective. When I talked about leave, leave is effective if that's what's requested and that's what's needed, but forced leave is not going to be effective for the person. I don't know how it's effective for an employer either, really, to have somebody out when they could be working. But I would say if the accommodation does not enable the person to do the essential functions, improve their performance or their conduct, then it's going to be ineffective. And it may just need to be tweaked, or maybe it just needs to be totally changed altogether. I don't know.
I tend to think it's like a relationship. You usually know both parties. Is it working for both parties or is it
not? Yeah.
If it's not working with both parties, it's not a good relationship. Something needs to be changed. Well, Melanie, that was a webcast full of a lot of great information. Thank you for that.
You're welcome.
And that is all the time we have today. If you need additional information or you want to discuss an accommodation or ADA issue, please feel free to contact us. We thank you for attending today, and thank you also to Alternative Communication Services for providing the net captioning. We hope the program was useful. As mentioned earlier, an evaluation form will automatically pop up on your screen in another window as soon as we are finished. We do appreciate your feedback, so we hope you'll take a minute to complete the form. This concludes today's